This is Kathy Philbin, certified nurse midwife from sunny South Florida. I'm here to try to do a new series here, and it's called 5, 10, 15. And in actuality, it's looking at some text messages I've received recently, actually right now, and it's in regards to 5 messages, the 5th message, the 10th message, and the 15th message. So our 5th message was from a patient called Bridget, and she actually was just calling to see how we're all doing with this coronavirus. So that was very sweet of her. She's a previous patient, and she's had a couple of her babies with our practice, and we get that a lot. So the next patient, the 10th text, was a patient, we'll call her first name Sarah, and she had a baby approximately 1 week ago, and she was calling in regards to wanting to figure out if she did or did not have mastitis, and if she did have it, what can she do about it. So mastitis is an infection that can occur in the breast, and most often it happens when the patient is breastfeeding, and if you do not have proper hand washing. And this can just happen. You're just so exhausted, and you're up all night trying to breastfeed every 2 to 3 hours, and you may have mistakenly not used a hand sanitizer or washed your hands, because basically bacteria from your fingertips are what causes us to get this infection. So the infection symptoms present as a redness, sore area, and in the breast, and it is getting worse, not better, and that you sometimes have fever, chills, maybe even feel very weak, and you almost feel as if you have flu symptoms, except it's not the upper respiratory type, but even like digestive issues too sometimes if it's really far gone. So when patients have this, they can do simple things if it's in the very beginning, which may get rid of the infection without actually having to go on an antibiotic. But if it's pretty far gone, most patients not only have to do some of these things that I'm going to tell you about, but they also have to do that as well as go on the antibiotic. So number 1, do not stop breastfeeding. Continue to breastfeed, and you're going to want to breastfeed the side that's affected first, and the duct that's inflamed, you're going to want to massage towards the nipple. And prior to breastfeeding, if you can put like warm compresses over the breast or take a shower, then that's going to help soften up that area. So you're going to massage towards the breast and encourage the baby to empty that breast completely. If you feel like the baby's not completely emptying your breast, then you're going to have to also pump as well. So the important part of this is that you're trying to actively empty that breast. And then the other things that you can do is keep hydrated, try to get rest, continue to do the good hand washing. If you're using a breast pump, then you're going to want to wash everything very thoroughly. The other thing that actually, it seems kind of ridiculous, but it actually does help. Even my own daughter did this when she ended up having signs of mastitis, and she actually was able to forego antibiotics by laying on her stomach, putting her breast in a basin of water with Epsom salts added to it, and she kept changing the water every 10 minutes. That actually was a good trick that helped. On top of having that painful infection inside your breast tissue, you do not also want to burn the skin. So sometimes people put those heatable like little bean bags into the microwave, and they try to use that, but you just have to be so careful, because when you have an infection, your ability to feel like hot and cold is reduced because of all the problems going on already with the infection in that area. So definitely makes a difference. And if you do go on antibiotics, complete the entire prescription. Just don't take it for a few days and say, oh, I'm better, I'm not going to finish it. But just take it as directed. Okay. And then our 15th message on here was from a patient named Jennifer, and she had called late at night, and it was around 11:30 p.m. and it was in regards to her baby was crying and she could not console the baby. So she's a first-time mom, and I asked her first of all if she was alone, and she actually said her mother-in-law was with her, and they actually get along. So her mother-in-law was also trying to soothe the baby, and at this point the baby is already a month old and she had stopped breastfeeding. So we went over like, how much is the baby actually taking from the bottle? Are you burping the baby properly? Do you notice that the baby is peeing enough? Is the baby also having bowel movements? So generally, like, I like to just talk through some thoughts with the mom and try to see. Sometimes babies are what they term colicky. Some have acid reflux. And then if the mom is really distraught, I actually told her in the end that it's okay to call your pediatrician. That's what they're there for. So she just wanted, to touch base to a live human being and not get a answering service. So she called me. She knew I would pick up. But also, in regards to this, if it's really serious, I know it's frightening and it's like a very hard, sometimes later at night too, it's hard to discern, is something seriously wrong with the baby, or is it just that, I'm also so tense, I'm making it seem worse or whatever. But it's better to seek outside help, and that's what I always encourage all the patients to do especially the 2-day after the delivery, when we talk about going home and what it's going to be like at home. If you are concerned, it's better to call and ask for help than it is to be at home and be concerned by yourself. Like, get the professionals involved, and hopefully, we'll be giving you good advice that will calm you down and help you solve your problems. So hopefully this little 5, 10, 15 session has given you a little bit more information, and I'll catch you next time. Take care. Bye.